Painful and recurrent, a stomach ulcer isn't just disruptive to digestion, it can seriously impact your quality of life. But contrary to folklore, ulcers aren't caused by too much stress, and a glass of milk isn't the best way to treat them. In many cases, ulcers can be resolved by dropping certain habits or taking medication. Here are the most common signs you have a stomach ulcer, and what you can do about it, according to physicians. What are the signs you have a stomach ulcer? The symptoms of a stomach ulcer are often similar to a regular upset stomach. Usually, the symptoms of an ulcer will not go away. Some patients may see blood in their stool or even vomit blood. In rare instances, an ulcer can cause an obstruction, and the patient will have nausea and vomiting. The most common symptom is upper abdominal pain. Occasionally the discomfort localizes to the right or left upper quadrants of the hypochondrium, the areas right below the chest on either flank where there are still ribs. Causes a stomach ulcer. By far the most common causes of ulcers are smoking, use of NSAIDs, nonsteroidal anti-inflammatory drugs, such as ibuprofen, and the presence of a stomach bacteria called Helicobacter pylori. Treatment. Ulcers are usually treated by getting rid of the cause, for example, quitting smoking, or no longer using the medicines that may be causing the ulcer. Ulcers can also be treated using proton pump inhibitors, such as omeprazole and pantoprazole. Although it's very rare, sometimes surgery is needed to resolve ulcers. When to see a doctor? If you're experiencing recurrent stomach pain or other symptoms that might indicate a stomach ulcer, it's a good idea to see your doctor. They will ask you about your medical history and use of medications. You may be advised to undergo diagnostic tests, such as one of the tests, blood, breath, or stool, for H. pylori bacterial infection, endoscopy or X-ray.